Hi everybody, we're going to wrap up our histology study with a discussion of tissue repair and membranes. If you're following me in the course pack, this comes from page 50. Let's take a moment to talk about tissue repair time. Some tissues heal quickly. You know this because a cut can heal quickly on your skin. We also know that some tissues heal slowly or poorly. You also know this because, say, surgery, for instance, may take weeks or months to recover from. Some injuries to the body, like those to the spinal cord or the brain, a person may never heal from. So what determines whether or not a tissue will heal quickly or slowly has to do with the types of cells that are found in that tissue, and also it depends somewhat on the blood supply to that tissue. Epithelial tissues are a great example of a tissue that heals quickly. Not only do they have cells that can grow and repair quickly, but there is also a blood supply that serves the connective tissues that underlie or support most of our epithelial tissues. While epithelial tissues themselves are avascular, they do receive good blood supplies from those nearby connective tissues. So, for instance, the epidermis of the skin heals quickly, a sore on the inside of your mouth may heal quickly, or other places in your body, such as the lining of our digestive tract, tends to repair itself in about every 2 weeks. Some connective tissues also tend to heal quickly. Some of our loose connective tissue types, like loose adipose, which is fatty tissue, loose areolar, and loose reticular, can heal pretty quickly. Bone and blood also can repair and make new cells to repair that tissue loss or tissue damage fairly quickly as well. Imagine life without having blood that repaired quickly. We would have long-term devastating effects if we had a simple amount of blood loss. Smooth muscle tissue is also a type of tissue that heals quickly. It forms the walls of our hollow organs like blood vessels and the digestive tract. Again, think of the devastation to our bodies if that tissue did not heal very quickly. Now, let's talk about tissues that heal slowly or poorly. Nervous tissue is somewhat plastic, meaning it can adapt to changes in the body and repair itself up until the middle teenage years. After that time period, we notice that nervous tissue does not heal very well at all. So nervous tissue is one of those that I would put in the column for those that heal slowly or poorly. Connective tissues that are dense in nature or cartilages also tend to heal slowly. The dense types and cartilages tend to have a poor blood supply, and that slows down the ability for these tissues to heal themselves. Finally, muscle tissue like skeletal and cardiac lack the type of cells that allow for the tissue to heal quickly, especially cardiac muscle tissue. There have been experiments done where we can insert some stem cells into the heart to regrow and repair damaged cardiac muscle tissue. Perhaps that'll be a way of the future and a way for us to repair these tissue types that tend to heal slowly or poorly. Let's now talk about the repair process for tissues that have been damaged. Well, the first part of the process involves inflammation. Inflammation doesn't feel very good to us, but it's a necessary part of the change that takes place in order to heal tissues. You'll notice that cells produce histamine and prostaglandins. That causes swelling in the area that's been damaged. This change also brings in blood flow so that we can bring in healing agents like white blood cells. So during the inflammatory phase, we tend to see swelling and we tend to see an increased flow of blood to that area. There are 4 cardinal signs of inflammation: swelling of the tissue that's been damaged, redness, warmth, and pain. So some of these may be more obvious to you than others. Certainly pain is a sign of inflammation, as are warmth and swelling. Redness depends on your skin tone, so it may be more apparent in certain parts of your body or in certain skin tones than others. Here you can see how histamine promotes vasodilation. This allows for blood vessels to expand and leak, and that allows for the surrounding tissues to gain white blood cells and other parts of the blood that can provide healing. This is a pretty serious histamine reaction. There's been a lot of vasodilation here. This may cause itchy hives, so that's not the normal case we should see for a histamine reaction. In this case, we may treat it with an antihistamine, something like Benadryl. So inflammation is meant to help us repair our damaged tissues. Here you can see a scab is formed over this tissue. We have white blood cells known as macrophages that have migrated in. They help to get rid of dead tissue. Dead tissue can be problematic because it can allow for an abscess to form in an area that cannot drain to the outside or to the inside. Likewise, we may see pus accumulate where a lot of white blood cells gather. All right, so inflammation is meant to be a benefit to our bodies. 4 cardinal signs are redness, heat, swelling, and warmth. Now, following inflammation is the regeneration of normal tissue. This time we see fibroblasts coming into the area that help form collagen fibers. Scar tissue may simply be in place for a temporary time period, and ultimately we hope should be replaced by normal tissue. However, if you have scar tissue months after a particular damage has occurred to a tissue, then that scar tissue may be permanent. So unfortunately, scar tissue is just collagen, and it lacks the normal things that we tend to see in our tissues. So perhaps no glands, perhaps no nerves, or lack of blood vessels. So here you can see some scar tissue. Keep in mind it's just collagen. Collagen is not meant to be stretchy. It's meant to provide flexible but still-like support. So if you're talking about skin, for instance, the normal functions of skin may not return if scar tissue persists after that skin should have been repaired. And here you can see some real images of scar tissue, a keloid scar there in the middle picture, and a large scar there, one that's done quite a bit of damage into that dermis of the skin in the far right picture. So you can compare that to the appearance of normal skin on the far left, which appears to have far less collagen fibers. Keep in mind, scar tissue is mostly collagen. So in summary, the process of repair to tissues involves the inflammation process, which is then followed up by the regeneration process. Scar tissue may persist if the normal tissue is not replaced, and unfortunately, scar tissue does not function like normal tissue. We'll actually go into more detail with this in a later chapter when we discuss skin. Let's turn over to page 51 and talk about membranes for just a moment. Let me give you perspective of where we're at. Cells build tissues. Tissues of a similar type build membranes, which are very simple organs. Membranes, or organs, will then go to build organ systems. So membranes are technically a very simple organ composed of 2 or more tissue types. There are 2 major membrane classifications we'll discuss: epithelial membranes and connective membranes. Epithelial membranes, like the name implies, cover and line body surfaces, both inside and out. They may be cutaneous in nature, such as the skin, mucous in nature, or serous in nature. We'll talk about those 3 in just a moment. Connective membranes may in fact be just connective tissues, and our best example here that we'll discuss is a synovial membrane. So let's talk about this particular epithelial membrane first. It's called a cutaneous membrane, and this is just fancy language for your skin. So your skin is composed of 2 main layers, an epithelial tissue layer and an underlying connective tissue layer. I'm just going to outline these here. So you can see together the epithelial and connective tissues that form the skin are working together as a membrane. And this membrane, of course, is called a cutaneous membrane, just fancy language for skin. So what you're looking at is stratified squamous epithelial tissue. It is keratinized. There is a layer of keratin that waterproofs this outermost layer out here. And there is an underlying layer of either loose areolar connective tissue and or dense irregular connective tissue. Now, cutaneous membranes are dry, and of course that is because of this keratin that's on the outer surface. This is the only membrane that's dry, and it's the only one that has keratin. Here you can see the keratin forming an outermost protective covering on that skin. It is a waterproofing protein produced by keratinocytes in this stratified squamous layer of epithelial tissue. Let's talk about mucous membranes for just a moment. Let me pause here and just make a point about the name. Mucous membranes are those that produce a sticky substance called mucus. So you'll see them spelled differently. When you see the word without the O, you're actually talking about the sticky secretion. But when you're talking about a cell or a membrane that produces that sticky stuff, there you're going to see the O involved. So just notice it's not a typo, it's just two different ways to spell and referencing what we're discussing here. So moist mucous membranes are found on the inside of your body. If you have an opening that cavity that opens to the outside world, it is quite likely lined by moist mucous membrane. Here we do not have keratin because we do not need a dry membrane. Let me outline the epithelial tissue for you here. This down at the bottom is our basement membrane. And below is where we find our connective tissue. It continues on beyond what we can see in this image. Again, we have an epithelial tissue layer. Underneath we have a connective tissue layer, so same basic construction that we saw for skin. Some of the organ systems that are lined with moist mucous membranes would be your digestive system, your respiratory system, urinary system, and reproductive systems. On your worksheet, you'll want to take a moment to jot down what the purpose of mucus is. Mucus does help us lubricate, and it also helps to trap bacteria. Okay, mucus helps to lubricate, and it helps to trap bacteria. Just another view of a moist mucous membrane. Here is a single layer of simple columnar epithelial tissue, and down below you notice there is another layer of connective tissue. Classic setup for an epithelial membrane. These are the moist mucous membranes of the stomach, and again you have these stomach pits that you can see here, and this is a layer of simple columnar epithelial tissue, lots of goblet cells there. You may recall that goblet cells produce what? Goblet cells produce mucus. Okay, and so of course underneath is a layer of connective tissue. So here's our epithelial underlying with a layer of connective tissue. These are the small intestine linings. They're convoluted into little hill-like structures called villi. Each villus is a finger-like extension. So of course here we see an increased surface area thanks to the epithelial tissue. Serous membranes are our final epithelial membrane type. They are composed of two single layers of simple squamous epithelium. They overlay a layer of connective tissue. So the outermost layer is the parietal layer, while the innermost layer is the visceral layer. Think of it this way, visceral implies that's the layer touching the organ. So the organ would be situated deep to that visceral layer. It will be found in here. All right, so again, serous membranes are two layers of serous, simple squamous epithelium. They overlay some connective tissue. These tissues are only found, or these membranes rather, are only found in our thoracic cavity and abdominopelvic cavities. And they cover those outside surfaces of our organs. They do not line the inner surfaces. Here you can see how the serous membrane forms. It does have an outermost parietal layer and an innermost visceral layer. That outermost parietal layer is in contact with your thoracic cavity or abdominopelvic cavity wall. The innermost visceral layer is actually anchored to the organ itself. Now, between those two layers, there's in fact a type of fluid. That fluid is called serous fluid. So on your worksheet, you'll want to jot down the function of serous fluid is to lubricate and reduce friction around your organs. Lubricate and reduce friction around your organs. All right, so let's talk about the three types of serous membranes. Over on page 52, you'll notice the peritoneum, shown here, is a serous membrane that wraps around the outer surface of the digestive organs. This is a piece of large intestine. Down here it's easy to see. And this transparent or clear membrane, that is called the peritoneum. And embedded in that peritoneum, you'll notice there's a network of blood vessels that nourish and bring nutrients into the body from that large intestine. So the serous membrane is really cool. It keeps your intestines in place, and if you ever have abdominopelvic cavity surgery and they move those intestines out of the way, it's pretty hard to get them back in place. So think of this as a thin membrane that holds together and supports those intestines. So in this image, you can see the parietal and visceral peritoneum coverings on the outside of these organs. Now, you may hear the word mesentery as a term to describe how the peritoneum membrane covers these digestive organs. So when you hear mesentery, just think of this peritoneum. Another view of that peritoneum here, covering, looks like the large intestine. It goes around like this, and this shiny surface in here that's embedded with blood vessels, that is the mesentery or peritoneum. Let's talk about the pleura for just a moment. They are examples of serous membranes that surround the lungs. And again, we have a parietal outermost layer that is anchored to the thoracic cavity wall. And we have an innermost visceral layer that is anchored to the lung tissue itself. Now, what type of epithelium makes up the visceral and the parietal layers? It is simple squamous epithelial tissue. What fluid is secreted by those two layers? It is serous fluid. So serous fluid helps to lubricate and reduce friction around these organs. You can see the pleura on the top picture, and on the bottom you can see the pericardium. It wraps around the outer surface of the heart. The pericardium is a moist membrane. Of course, there is a layer of serous fluid between the parietal and visceral layers, and the visceral layer is anchored, as we expect, to the underlying muscle tissue of the heart. Here's another view of the pericardium that surrounds the heart on the outside. And that pericardial fluid is just specifically named for the serous fluid in between the visceral and parietal layers. All right, so let's take a moment to look at this picture here. You have two layers of pericardium. You have an outermost layer and an innermost layer. Letter A, you'll notice, is peeled back off the heart. Is letter A your parietal layer or your visceral layer? Well, letter A is your parietal layer because it is the outermost of the two layers. That means that letter B is the visceral pericardium. It is anchored directly to the heart muscle tissue itself. Between those two layers, we have a type of fluid here called serous fluid. Just another view of the pericardium. It really looks like a steak, right? So you've got pericardium wrapping the heart. There's a lot of fatty tissue there as well in this image. All right, on the very bottom of page 52, let's talk about the connective membranes. There is only one example we'll discuss. They are called synovial membranes. Now, since they are connective membranes, they contain only connective tissues. These membranes, synovial here, are found only in the movable joints, such as your elbow, knee, hip, ankle, shoulder, fingers. And once again, you have a type of fluid that's found in these synovial joints. By now, I should sound like a broken record. These fluids, whether they are serous, mucus, or synovial in nature, help to lubricate and reduce friction. So imagine not having fluid in between your knee joint. Imagine how painful that would be when the bones rub against each other. So we are meant to have some fluid in between all of our movable joints to help reduce friction and lubricate that joint. Hey, think of the Wizard of Oz. The Tin Man needed to oil up his joints to get moving. Same concept here. That's what synovial fluid helps us do. Here in this picture, you can see just a generic looking joint. This could be your elbow or your knee, for instance. And the synovial fluid that we have is found in that space between those bones and the cartilage. And again, the whole point here is to help reduce friction and lubricate that joint. So we'll talk more about joints in a later chapter, but for now we'll just leave it at this. Synovial membranes, shown here, that line that joint cavity, produce fluid that we call synovial fluid.